After the age of 50, we lose about 1.2 to 1.5% of our muscle strength each year and about 0.8% of our muscle mass each year. And this cumulative loss is what leads to a gradual loss of function for older adults. So, how do we prevent this? Well, certainly there's a lot of data around general resistance training, maintaining that activity and movement that is so important. But there's also one supplement that we think of traditionally as something you'd see in younger gym goers that has been shown to have some really impressive benefits in people over the age of 50. This is creatine. And why does creatine work? Well, you can think of creatine as a battery cell for our muscles. And what it does is once we're in an exertive state, it helps to give our bodies that extra push, that extra energy to work through an exercise. And that's why people who are at the gym trying to gain muscle mass use this supplement frequently. And people have studied this now in older adults. And what they found was that people who combine creatine with resistance training were able to gain almost 3 pounds of muscle mass relative to people that didn't. Now, the important thing about this is that taking creatine alone without incorporating resistance training has far less and more mixed data around it. So it's important to do both based on the scientific evidence. In terms of choosing a quality creatine, you want to look for ones that are manufactured in places like the United States, Germany, Japan. There are certifications such as NSF and Informed Choice that you can look for on the label. The typical dose is 3 to 5 grams per day. Those are the doses that have been generally most studied. There are some studies that look at more, and the data there is a little bit less robust, but certainly about 5 grams a day is generally a reasonable dose to be taking. Always important to speak to your physician before starting this. There is some data for people that have kidney uh, problems and whether it is still safe. More and more of that data suggests that it actually is safe, but it is important, whether or not you have kidney disease, to talk about this supplement with your doctor before starting it. I wrote a Kin report covering this topic. You can check it out at the link below. Thank you.